Hi, my name is Sharon Frank, and I'm a speech-language pathologist specializing in treating exercise-induced vocal cord dysfunction. I'm also the creator of the P.I.E approach. There are several terms for VCD out there. There are terms that are used more by speech pathologists like paradoxical vocal fold motion, or PVFM, but a more recent term that's out there is exercise-induced laryngeal obstruction. I'm going to be using the term VCD for these videos because it's the term that most of the public uses when they call here, and also it's the term that I believe is given to them when they are consulting with their doctor. That's the term that they're the most familiar with, so that's the one I'm going to use the most. And I am going to be also using these videos to talk about exercise-induced vocal cord dysfunction. There are different situations that result, or different things that can lead to vocal cord dysfunction, not just exercise. But what I'm going to be talking about is just the exercise-induced vocal cord dysfunction. So what is vocal cord dysfunction anyway? So let me give you a really just very basic, simple definition of vocal cord dysfunction before we progress farther into the video. Just to kind of get you situated here, this is called the larynx, or the voice box. The larynx sits right on top of the trachea, or the windpipe, which leads to the lungs. Normally, when people are just breathing, not talking, not swallowing, not singing, the vocal cords should just be open like this. But what happens with vocal cord dysfunction is the vocal cords then start to close a little bit, or sometimes more than a little bit. And so this area around the vocal cords, or a little bit above them or around them, tend to close. And that leads to difficulty with breathing, and that leads to different symptoms. Now, there are many, many different treatment approaches that speech pathologists use to treat vocal cord dysfunction, and there's not one correct approach for everyone. Some work for some people, some work for other people. So that's important to keep in mind. When I first started working with vocal cord dysfunction patients, I was using some of the more traditional methods, but the thing is that as more and more vocal cord dysfunction VCD patients arrived on my doorstep, I saw that this is a pretty complex disorder, and I think there's more to it than just opening up the vocal cords. And so I started to look more and more into breathing, and because I saw breathing patterns and habits seemed to be off. And so I got some extensive training in breathing, and I learned a lot more about breathing than I did in graduate school. Learned some very interesting things, and I really had no idea how much breathing impacted us throughout our entire day and almost everything we do. We breathe actually about 20 to 25,000 times per day. It's just about the most basic, fundamental thing we do. And so wouldn't it make sense to look at breathing a bit more and breathing habits a bit more as it related to vocal cord dysfunction? At least that's what was drawing me to it. So when I did that, things really started to change for me. And I looked at breathing and how breathing impacts emotions and vice versa. And it just became this much wider net that I cast into looking at how I was going to treat vocal cord dysfunction. Because I realized that there were cognitive aspects and emotional aspects that were part of VCD, and I wanted to be sure to include that as well when I was helping patients to improve their breathing and to overcome these obstacles so they can really enjoy the sport that they love. And so that led me to the creation of the P.I.E approach, which really differs from other approaches, I guess, on two basic philosophical platforms. And that is that one is, as I mentioned, it's more of a holistic approach because I'm looking at the physical aspects, and which is the P part, and then there's the I, or intellectual / cognitive part, where I'm connecting with patients cognitively and helping them to really understand and experience and sense the differences in the breathing. And then there's the whole emotional component of breathing and how breathing and emotions are so much connected. So it's more of a holistic approach, in my opinion. And then the other part, how it differs, I believe, is that I'm trying to look more at just getting the vocal cords to stay open, and instead of just kind of treating the vocal cords and working at the level of the vocal cords to have them stay open, I'm trying to get a little bit deeper and look at, is there more of a root cause that's causing this problem to happen in the first place? Assuming that everything else is clear, that there's no other medical, cardiac, or upper airway structural abnormality or something else going on. But is there something in the breathing behavior that's leading to more of this vocal cord dysfunction? So trying to get more to the root of the problem. And then I would say there's 4 different ways that the P.I.E approach also, in my opinion, is different from other approaches. And one is in the evaluation process, I use a CAPNO trainer, which really gives me a good look at the patient's breathing chemistry, for example, carbon dioxide levels. And I use a pulse oximeter also, so I look at the oxygen in their blood. And then it also gives me a chance to look at their breathing behaviors in about 4 or 5 different ways, and that can tell me a lot of information. In the therapy part, I use principles and some methods of Buteyko breathing. That's Buteyko, Buteyko breathing. And the goal of that is to optimize oxygenation and to correct breathing patterns and habits to normalize the breathing pattern. And then also another way that, I guess a third way that it's different is I use myofascial release. And myofascial release helps to alleviate muscle tension in areas that may have resulted because of these repeated VCD episodes. So tension in the throat, in the chest, in the ribs, sometimes the shoulders, the abdomen, areas like that. And then another way that's different is, other than just helping someone to learn how to breathe correctly in the clinic, I also then, once they've mastered things at a certain level in the clinic, then we go out to the soccer field if they're a soccer player, or the track if they run track, or cross country. We also start with fitness equipment before we even get to the track. So there's a natural progression of learning to use these techniques from at rest, and then moving around, and then being on equipment, and then actually going out into, let's just say a broader term, the field. And then there's one other part too that actually, I guess there's technically 5 parts of this that are different, because with the 5th part, just going back a little bit to Buteyko for a second, it's not just working on the breathing for sports, but a lot of the things that I use with Buteyko, it really helps the patient to normalize their breathing pattern when they're not in sports. So they can apply these principles when they're taking a test, if they're nervous about taking a test, or getting ready to take, for example, college entrance exams, their driver's test, meeting somebody new, just other things that, well, actually, especially also if they're getting ready to run in a meet or some other kind of tournament or something, that there are breathing techniques that they can do to help calm themselves down before they start the race. So they're starting at a good advantage, because it's very, very normal for people to get anxious when you're about to start a race. That's normal. But it's wanting to make sure that you keep that calmness, or you get that calmness to a certain level before you start running, and that makes the run so much better. So those are just a few ways of my describing how the P.I.E approach is different in 2 philosophical ways, and then also the 4 or 5 different parts of it that make it, in my opinion, different. Again, there's not one technique that's good for everybody, Some benefit from one, some benefit from another. This is something that, in my personal experience, I have found to be a very helpful approach in helping patients with VCD so they can perform better in the sport that they love.